They did have a very good call over the weekend where we cleared the air about the rationale and what we were doing and why. And it was really quite a bit of misinformation that was out there, and what it needed was a good communication with everybody. So this is a protocol that has been put in place for the pandemic. And it was initiated, we've used a very similar protocol during H1N1 in 2009, but it was initiated by myself a week and a half ago in consultation with some of the fire services, but primarily with BCEHS for two reasons. The primary reason was because we were moving to phase 4 of our personal protective equipment framework. And we knew that we were in pretty dire straits at that point, where we had lack of access to personal protective equipment. So it was aligned with a number of things that we were doing, including cohorting of people in hospital, which you've heard me talk about, and allowing healthcare workers to wear one set of respirator and eye protection for the duration of their shift. We had that same thing happening with the paramedics, where we advised the paramedics that they needed to go to a single respirator for shift unless it was damaged or soiled. So in conjunction with that, one of the other measures we do is reduce the number of people who are potentially exposed to COVID-19 and need to wear personal protective equipment. So that was the rationale for non-paramedic first responders not being called to calls where the paramedics can be there first for the medical calls, to reduce the number of people who have to be at the scene and reduce the number of people who need to wear the personal protective equipment to do that safely. I mean, a third reason, of course, is because we want to protect our fire services as well. They have other very important roles that they need to play, and if they were responding to medical calls where they were potentially exposed to COVID-19 and needed to be off work, that could leave critical supply issues or critical personnel issues in our fire services. So it really was a number of things that were happening to make sure that we have protocols in place that best protect our PPE, make sure that the medical calls get the attention they need, and also protect fire services so that they're available for the other calls that they do, which are, of course, responding to fires and gas leaks and the other important work they do. So it was not a reflection, as it seemed to have been interpreted, of the value of fire services and other non-paramedic first responders responding to medical calls. I will say as well, it was, the PPE was the main thing. We also know that call volumes are down because people aren't moving out and about as much. And so the paramedics and the BCEHS and the dispatch service has been monitoring this very carefully to make sure that we do have adequate people who are able to respond in a timely way to those calls. And this is something that is not, I mean, there are ways that we know we have to do things differently in urban centers versus some of the more rural areas where there are fewer paramedics and more fire service, for example. So this is something that has been worked out in a protocol between BCEHS, the dispatch service, and the fire services, and we now have an ongoing stream of communication to make sure that everybody is up to date on how it's working if there's challenges that come up. But the primary reason was to protect the supply of personal protective equipment we had, and to protect those non-paramedic first responders from being exposed in the first place. And I will also say the analogy that we're using in the hospitals, for example, is reducing the number of people who provide care to somebody with COVID-19. So we reduce the number of healthcare workers who are potentially exposed. And it's a very similar analogy that we use in the field. And it is a protocol that unfortunately was misunderstood by some when it first came out.